Why is U.S. healthcare failing men? That is the huge question today. Dr. Pazona's got answers, and they start in the bathroom. This one goes deep. Next on Doc Stars.
Welcome to DocPod's Doc Stars.
My name is JJ, your host, and today we are joined by Dr. Joseph Pazona of the Balls Deep podcast, and of course, a fantastic urologist in Nashville, Tennessee. How are you?
I'm great, JJ. Thanks for having me on today.
Oh, we're excited. You know, when you and I had chatted kind of offline previously, and I started doing a deep dive on what it is that you do, I was really excited because obviously I have a personal interest in this, but as well with DocPod and DocStars, we really want to try to get someone who is thinking outside the box and really bringing us kind of the latest and greatest. And I think you definitely do that. So thinking outside the box, I kind of want to start with understanding your why, right? The why behind launching the Balls Deep podcast last year and kind of what's your mission there?
Yeah, I think it's important that doctors get out in front of patients and get in front of them digestible information that's also accurate. We live in the age of misinformation where it's no longer a lack of where do I go find this? It's how do I interpret what's in front of me? And I think there's a couple different camps. You've got the non-experts who play the game, get a big following, and people think are experts. I think we were joking about that. Someone pulling up like a 22-year-old kid on YouTube talking about some health stuff. It's like, what do you know about this? And then on the flip side, there's some awesome doctors out there putting out great content, but it's deep and heavy, man. It's like if you don't have an advanced degree or you're really into learning that level of detail, you're going to be lost. So the reason I formed Balls Deep was to kind of be that happy, middle ground where we have some fun. We want to keep you entertained, but it's in a digestible, approachable way that you and I would just kind of talk if we're sitting enjoying a beer together, right? Like it doesn't need to be the deep dive pathophysiology on the Krebs cycle or how protein synthesis occurs, but you do need to know that you should probably eat a certain amount of protein per day and get 8 hours of sleep at night. So I wanted to find something that really spoke to people, that really showed like, this is exactly how I'm going to interact with you if you came in my office. And, I wanted to just get out in front of this because I believe as physicians, we have a moral duty to let people be aware of what we have to offer. Because most people just think like, well, I'm stuck. I've got to go see that doctor who's in my network and lives in my town. And I guess is my only option. And that's not the case anymore in 2025. There's people doing telemedicine like our practice. There's a lot of great information and experts out there. So I don't want people settling for just, this is the mediocre option in front of me who's in my network.
Yeah, and that's a really, really great point because I think a lot of us do settle, and I'm sure you've spoken to patients and you found out later that a lot of us do. A lot of us aren't doing the research we should do and really kind of honing in on that. And that's such an important thing. And by the way, did you come up with the name Balls Deep? Be honest.
I mean, listen, man, I said to my wife one day, I said, listen, I'm going to write a book one day and I've already got the title. It's going to be Balls Deep, My Confessions as a Urologist. And a podcast opportunity came up before the book's been written. So, again, it's like, we got to listen. You come to my office, I'm going to treat you with privacy, follow HIPAA. I'm going to be empathetic. Like, people understand that, you and I may have a casual conversation here, but the same token, we've got to start breaking down these barriers about this stuff and thinking that it's got to be this stuffy white coat doctor who just speaks down to you while maintaining some professionalism. So I figured, in today's day and age where there's a lot of noise out there, we better grab some attention with a fun title. And here we are.
I love it. And I couldn't agree more because I think a lot of times we need to make this stuff digestible. That's why we lose people, right? That's why we kind of, we start going into what you said, the white coat, and we go down this spiral of medical terms. I think none of that is going to be beneficial unless the patients are really receptive to it and it's translatable for them, right? And so that's what I really like about what you're doing because you're taking, which, let's be honest, can be sometimes really, deep, topics that you're talking about, and a lot of words that most of us don't understand, and you're making it a lot more digestible, which is really, really helpful. And I guess what I want to know is kind of what's the origin of the motivation in terms of when I was doing my research on you about kind of moving out of the insurance-based model and focusing more on a concierge-style care, because I also like that, and we'll talk a little bit more about why, but what are your thoughts there?
The traditional healthcare system is broken, and I left it because it treats people like they're objects on a conveyor belt. You've got 7 minutes and a prayer to hopefully get your question answered, and then they're moving on to the next item on the conveyor belt. And people want to demonize the doctor. Oh, you don't care. This is because you're greedy. I don't think people understand the how broken the system is. And if that doctor doesn't see that many patients in that time, they literally can't keep the lights on. We talked about this yesterday.
Hmm.
Inflation since 1998 has been about 82%. During that same time period, doctors' wages have dropped 10%. And I'm not a mathematician, but those numbers aren't good. So imagine anyone running a business, a restaurant owner, a plumber, a lawyer. And if over the past 20, 30 years, your expenses from your rent to what you pay your staff to your IT bills all went up 82%, and your wages were down 10%, it's not sustainable. And so I've never been a complacent person, JJ. I quickly realized that about myself when I got out into practice, because initially I was like, oh, I'm just gonna be a doctor. Forget all this business stuff. Forget about all this, healthcare admin. I trained for 13 years after high school. I just want to go be a urologist and a great doctor. Well, I then had that, wake up call of like, well, that's nice, Pazona, but guess what? You're in a broken system.
Whoops.
And so, you work at an office and you have rude people working your front desk. You have people who either don't know how to answer a phone or simply don't answer it. You have inefficiencies and bureaucracies that impede how long it takes you to get all of your quote administrative work done so you can actually spend time looking at a patient and connecting with them. And every time I came up with some idea, the answer was always, oh, stop that. Just this is the way we've always done things. And I don't think anything boils my blood more than hearing this is the way we've always done things. I'm like, guys, this is healthcare. I mean, just medical information alone, JJ, 50% of what I learned 10 years ago is now proven false. I mean, and that's just time and time again. It's rapidly changing. So you're going to tell me we're going to practice medicine like it's the 1970s again, when doctors can literally like pull out a sheet, write down patient with ED needs Viagra, want $300 from insurance, hand it over, and then they got paid $300. I mean, and no one asked any questions. So we have to change and adopt and adapt. And I couldn't function anymore in the broken system. It wasn't tenable. It wasn't the sort of healthcare I felt good about practicing. And also in the real world of private practice, I mean, I wasn't gonna be able to literally pay my bills, JJ. I know that's hard for some people to believe. Like,
Wow.
dude, you're a urologist. I was like, well, I live in Nashville. I've got 3 kids and an ex-wife. Like, I've got a lot of bills, and I'm going to spend an hour with you and then fight United Healthcare for
Yeah.
$83. Like, it doesn't work.
Wow. And it's great that you frame it that way, because I don't think any of us have a clue about that, me being the patient, right? In terms of what you're saying. Because we all think that, look, I have a lot of friends who are doctors, they have nice homes, we all think they're rich, they have tons of money. And don't get me wrong, I'm sure a lot of them do well, but we don't see kind of behind that curtain that you're talking about. So framing it for us and kind of giving us a look at really what's happening today is really important. One question on that note, which is interesting, when you made the move, did you ever have any reservations, or did you make the move and once you got into it, you were like, oh my gosh, why didn't I do this sooner? What do you think?
I think there were two transitions, just so the listeners understand kind of the whole story. So the first transition was making the decision I'm going to open my own practice, and I did that back in August of 2020, in the middle of the pandemic, where everything else is
Wow.
shutting down, businesses are closing, and I got the harebrained idea of like, now's a good time to start a business. But I did so again out of necessity, but it also when you have restrictions and constraints in place, it causes you to get creative and innovative with how you do things. And so it caused me to really be lean and look at every aspect of a medical practice and say, all right, what is absolutely necessary to keep the lights on and do my job on a daily basis? And unless something else improves the doctor patient relationship or the patient experience, we're just not going to do it. And so that started my journey into a physician entrepreneurship that was just, drinking from the fire hydrant and learning every day, because I don't have an MBA, I have no business background. No one in my family taught me business. I didn't come from money. So there was no like golden parachute to protect me either. Like I had to figure this out.
Right.
But I did so at that time with the mindset that the insurance model is broken, and I know one day I'm going to have to pull the plug. I'm not an economist, but the numbers don't work. I need to do this today because I got to pay some bills and I've got to open up my doors to everybody. But I sort of set myself up from the moment I opened my practice with uh, some alternative cash revenue lines, hormone optimization. We launched a weight loss program. We offered some extra anesthesia that insurance wouldn't cover. So I was already in that sort of mindset of let's build up a base of patients who are interested in wellness, interested in things
Hmm.
that may not fall under the realm of sick care, but are legitimate medical services, just as you get cosmetics and go to a med spa and pay cash for that. You can have that sort of hybrid approach, such that back in January, so about 6 months ago, we reached a level, JJ, where I tried every iteration of a private urology practice, doing it by myself, scaling up to multiple offices, having one office. And ultimately, no matter which iteration I tried, it added complexity, it added top line revenue, but it wasn't profitable enough to solve all the complexities. And it just became this sort of vicious cycle where every time we tried to grow, and because if you don't grow as a business, you're
Yeah.
dying. Like people are like, why do you keep doing that? If you are a business and you are not growing, you are going to die. And I don't think anyone who hasn't run a business understands that. And so we looked at what's the one decision that I can make on behalf of my team and my patients, because otherwise I'm gonna have to close the doors, that if I make that decision, everything else gets easier. And that decision was pulling the plug on insurance. And so there's a very long answer to what's it been like, and how am I doing with it. Listen, it's been a challenge. I think the right patients who value what we bring to the table get it. The people who look at healthcare as a commodity just want to, again, make an assumption. You're a rich doctor. You're greedy. How dare you not take insurance? And
Yep.
they go down the street and they wait several months to get 5 minutes with a doctor who barely pays attention to them and practices 1990s medicine. So, again, if you think it's a commodity and that's what you want is your experience in your healthcare, by all means, I'm not angry at you, but I know that what you get when you're in our office is a different experience of higher value. And it's a decision we had to make for the sake of treating patients and keeping my doors open.
Yeah. First of all, I love that because it seems like when I'm listening to you, what I'm also hearing is that when you do that from our side as a patient, I don't feel like you're probably looking at your watch every 2 seconds and going, I've got to do 4 more in the next 1 hour. Am I off base there, or what are your thoughts there?
I'd love to share with you two stories that exemplify what our new practice looks like. I was meeting with a patient. He had had a negative experience with someone previously, and had already invested money into his health and including in our practice, and just wasn't happy. And I said, Steve, I'm going to make up his name for HIPAA. How about this? I'm going to work with you on a weekly basis, and I'm going to work on getting your health back in order, because I believe a lot of the problems you're having are more likely related to your diet, your sleep, and your lack of exercise. And I said, in fact, it's a beautiful day outside. Can we go for a walk together? And he said, sure. So we did a doctor's office visit outside walking, just talking health. Like, why do we
Wow.
sit in a sterile office and promote health when as doctors we're hunched over some computer all day and don't move, and how many doctors aren't in good shape themselves. So that's one example of how our model is. Another, I had a guy who he's awesome. He's the model patient. He takes his health seriously. He appreciates what we do. He understands the nuances of the healthcare system. And I was chatting with him probably for about an hour, and he goes, "Joe, I'm so sorry. Like I've been keeping you for so long. I should go." I go, "Bill, it's my pleasure. I had no other patient to see today. I came in just to see you, and I'm all yours." And so it shows that for everyone who wants to label me as greedy or any of my colleagues as a doctor, this is why we went into healthcare. I've met very few physicians in my career, JJ, who are, quote, bad people. Now, they're out there. There's bad priests, there's bad athletes, and there's bad doctors. But most of us went in with pretty noble intentions, but it was decades of a broken system that have left us to be just a fragment of the person we were when we first entered. And so I'm rediscovering the joy of patient care and of being in the clinic, because I don't have to follow insurance's rules. I can just treat you like a human being and do what's best for you. And it feels really good.
That's amazing because we've all been there, right? In any business where you just get burned out because you have a quota, you have this and that. And I think that's what you see with most doctors. They're burned out. Literally, I go in there. I had an appointment last week for a regular primary care provider. And as I was talking to her, she was literally on her phone, and I looked, it wasn't looking up my charts or anything. And then I made a couple comments, and she said two things and I said, "Great, I think we're all set. I'll have the nurse come back in." And you have that feeling like you're kind of boxed in there. They're probably burnt out. They're billing like it's a factory. All speak to the points of what you're talking about. And I'm curious because the only time I ever really heard, let's call it the concierge kind of clinic style, a couple of my friends had Botox or something like that, where maybe it's a little more common to do this type of clinic. But what percentage do you think, or do you know, of doctors are moving into the space which you're doing now versus the traditional? What would that look like, do you think?
In primary care, it's a growing trend, and I think it's something that is honestly a necessity. There is no way in an insurance model for a primary care office to keep the lights on. You do not make any money to pay your rent and pay your bills and pay your staff delivering primary care where you were just counseling people, refilling medicines, doing physical. I mean, the amount of money that doctors receive for those services is laughable. I pay more money for my plumber to come out and
Wow.
fix a leaky pipe than doctors are making for high level visits with very sick people. And so in the primary care space, there's a couple different models. It's called on one end, DPC or direct primary care, where that is typically a micro practice, one provider, very lean. They sometimes don't even have offices. They do house calls or they rent some office space. They're able to get medications at cost, lab fees at cost, and you pay a low monthly membership, often under $100 per month, and you get all of your healthcare with them, and there's no added cost to it. On the flip side, you have some of the concierge docs, the docs to the stars, who
Mm,
are charging quite a bit amount of money, but they give you the utmost privacy. They're giving you a healthcare that's above and beyond what you'd normally get when you go to your regular general internist. They're working on keeping you alive long and well. And in that situation, you might have a 3-hour house call with the doctor. But they are giving you a deep dive into how to live healthy and avoid sickness. So when you look in the specialty space, it is less common. And I don't even consider myself a concierge doc, because that makes it seem as if I give special attention to patients now and I didn't before. I always treated every patient like a VIP, and I don't care whether you had Medicaid, you were uninsured, or you were a billionaire. I mean, we all put our pants on, one leg at a time, and we all pee at the toilet, and at some point it's going to
yep.
dribble. So, really, it's a direct pay model. You, you're going to pay me directly for my services, and I'm going to give you direct service without having to ask a gatekeeper as to whether it's okay. And we're seeing more and more people do it, but certainly in the urology field, I know that we're certainly one of the, the pioneers that are out there, especially from a general sense. But there's more and more people considering it because of all these problems.
Yeah, I think that's amazing. And I think more and more people need to know about this. And that's why you're on the show today. And I love what you keep doing and promoting what you're doing, because it just seems like there are so many benefits to it that outweigh the negatives, if you will. And when I look at the insurance trap and we try to dissect kind of who it really serves, I don't feel like it's us. And from what I'm hearing from you, it doesn't sound like it's really serving the doctors that well either.
It's broken up and down, JJ. I mean, let's look at some of the numbers. We spend $4.6 trillion on healthcare in the United States, and yet 40% of us are obese. And yet depression, suicides, loneliness indexes are all at a sky high rate. We're not doing it right. It's broken. And listen, if you have a legitimate illness, you have a heart attack, you are in a car accident, you have a terrible cancer, there's nowhere else in the world I'd rather be than here in the United States to get that level of care. Don't get me wrong. But when it comes to primary care, when it comes to preventative medicine, when it comes to outpatient, non-urgent care, we're awful. And it's not because we don't know what to do in all cases. It's because the system is broken. It doesn't allow us to do our job to the top of our license. And we've got a lot of just burnt out doctors. And so I'm lucky because I didn't wait till I burned out. I broke free. And I say I opted out of insurance and truly opted in with my patients. And that's the motivation for doing this, because I can prescribe Viagra 7 days a week to guys with erectile dysfunction. But if I don't sit there and work with them to understand why they have poor blood flow down there and work on lowering the size of their waistline, reversing their type 2 diabetes, getting them some quality sleep, lowering stress in their life, if I don't work on that, I'm just a pill pusher. And you don't need to come see a board certified urologist who's been working for 20 years and trained for 13 years on top of that to get the little blue pill anymore. Just go online and see some digital pharmacists and they'll just give it to you. So, we've got to look at better ways to leverage the expertise that our physicians have built over the decades, because it's not working the way it's going now.
Yeah, it almost seems like the incentive for all of this is not right. You know what I mean?
Mm-hmm.
When you look at how the insurance works and everything, and we're almost incentivizing just kind of this, push them through the door, get as many as you can in a day, et cetera, the insurance companies, et cetera. And you look at that, and then again, I mean, I feel bad for some of the doctors, I probably some of them, and probably a lot of them, like you said, like a lot of us do, we go into a business and we're excited to be there. And then sometimes that business beats you down over time when you see the bureaucracies and everything that's involved with it. And I think that's such a good point. And also, you helped me make a little segue here, because I want to talk about more specifics in terms of, as I was doing the research and looking through your site and what you've been doing, and with Balls Deep, you kind of have this thesis, which I love, which is kind of optimizing for the bedroom, the ballroom, and the bathroom and the boardroom. And I want to start with the bedroom because I think it's something that, in fact, when I told our founder of DocPod, Paul, that I was going to bring up my own story, he's like, "Oh, that would be amazing. Are you sure you're okay with it?" And I'm like, "Yeah, of course." In fact, I even told my wife, as you do when you're married.
Yes.
She's like, "You should definitely bring that up because more people need to hear about it." And I have guy friends who don't talk about it, who bury their head in the sand. In fact, I even had a friend of a friend who said, "Can you call my friend?" Because I had prostate cancer, and can you walk him through it? And I told him what it looked like. And we'll talk about that a little bit more. But he said, "Yeah, okay, JJ, I appreciate that, but I really don't want to mess up what I have going with my new girlfriend right now. And if I remove my prostate, that might mess it up." And I'm thinking to myself, isn't the goal here life preservation? So let's talk a little bit about the bedroom and erectile dysfunction, these types of things, disease, libido, all these different areas, because it's amazing to me that more men just don't go for the most important part, which is making sure you're proactive and try to save your life versus, how you're going to come off to your wife or girlfriend. But yeah.
Yeah, it's an excellent place to start, JJ, because listen, for most men, that's where their main central nervous system
Exactly.
is. It's down below the belt, right? That's where we do
It's
all of our
true.
thinking. But let's be honest, if a man's penis had a therapist, it would say, "Why do you keep ignoring me?"
Exactly.
It's we just want to get the band-aids. We want to quietly just log into our computer and discreetly get some Viagra or Cialis mailed to our home and then just ignore it. And as long as that keeps working, we're just going to keep on with life as is. And listen, don't get me wrong, the pills have their time and place and are great when you need to quickly get back into the game. But the penis is literally a dipstick for your health. Sexual health is health, and the reason behind that is most erectile dysfunction is due to poor blood flow. And what causes poor blood flow? Obesity, type 2 diabetes, high blood pressure, smoking, high cholesterol. If those things sound familiar, they should, because they're the same exact things that lead to heart attacks and strokes. And we have a lot of data, JJ, saying that when ED sets in later in life, it is sort of the canary in the coal mine and precedes heart attacks and strokes by 5 to 10 years. So rather than sitting there in silence and denying you have a problem or just fixing it with a pill, that should be the red flag like, hey, man, your body's telling you something, you need to get evaluated because your blood flow is getting clogged and it's just a matter of time before it hits something that you can't fix.
Yeah, I think that's such a good point because I remember I was talking with a friend of mine recently, and I was talking about kind of the holistic approach, but in terms of everything is tied together, right? So my oral care is part of my health care, like you're talking about, and we're talking about the bedroom and erectile dysfunction, and talking about weight and cholesterol. All of these things are tied together, right? So the healthier you are, hopefully you diminish the probabilities of having other issues. Now, that doesn't mean it's going to make it perfect, but it's amazing how so much of it is tied together, right?
80% of the diseases we are going to die of are because of lifestyle. It's not because of bad luck. It's not because of genetics. It's things that you choose to do on a daily basis that are impacting most of your health. Don't get me wrong, there's people who get terrible rare cancers for no reason. There are genetic diseases and things that run in families for certain. But 80% of the time, it is, what are you putting in your mouth? Are you sleeping enough? Are you moving your body? Are you optimizing your hormones? These are the pillars of wellness. These are the ways to avoid illness. And these are the ways to feel young and vibrant and keep everything healthy. And that's exactly why Pazona MD is now outside of insurance. That's exactly why we have the Balls Deep podcast, is to talk about these things. Because if these pillars are not strong, like any building, if it does not have strong pillars, it's going to come crumbling down. And without our health, we have nothing. Nothing else matters in life.
100%.
You can't have relationships with your wife if you die of prostate cancer. You can't continue making money or enjoying your job if you're in the doctor's office all day or you feel like crap because your hormones are terrible or your blood sugars are all over the place. Nothing else matters without our health, but yet here we are sitting in silence while 40% of US adults are obese. And what happens in a typical doctor's office is, all right, I got 5 minutes here to refill on your medications. Let me type this in. Oh, and by the way, I think you should lose weight. Have you played pickleball before? It's a really great sport. You should try it. Intermittent fasting works pretty well too. Any questions? Great. I'll see you. Like that.
Uh,
That's not solving any problems. Great. You check that box. You talked about their diet and health. What's the likelihood that person's going to take any of that and make an impact in their lifestyle? It's about zero. So we've got to do a better job.
yeah, it's so true. And, it feels like the hardest issue here is one, obviously making sure that, doctors don't have to run so many patients through the mill and where they can give better service. And what you're doing, I think, is an amazing start. But for me, the other side is thinking about men in particular. How do we break that silence, right, around these issues? And I think hopefully what we're doing today is part of that, right? And I told this to my wife. I said, listen, she goes, "Are you comfortable talking about that?" I said, "Of course, because look, I'm old enough. I'm not 22 years old anymore. So I think at this point in my life, if I can help other people kind of understand the situation that I've gone through and prevent them from having to go through it, or at least maybe potentially save a life by having them getting checked out instead of burying their head in the sand, or at least just creating the narrative and starting the discussion, then I feel like that is a huge part of this. What are your thoughts?"
Strength is not silence. Strength is speaking up, asking questions, and owning your health. That's the true mark of a strong man. And what you're doing is promoting that behavior and bring awareness, going, listen, we're guys, we talk about this stuff and it's okay. You shared with me before coming on here about your prostate cancer journey, and I know we're going to get into that. I was an overweight kid who grew up in an unhealthy house my entire life. I have high cholesterol. Some of it's related to dietary choices. Some of it is out of my control. But I discovered that on my own. I'm doing something about it. I take Cialis every single day because I have some mild prostate symptoms. Yes, I take Cialis, and that's okay. I'm taking it because it also might preserve my health long term and keep me performing in the bedroom and the bathroom. So, these are the things people need to know about is it's okay to talk about this. You're not a bad person because you had your prostate removed and might be going through a recovery, or you're not less of a man. And same thing with me. It's the speaking up that shows this doesn't define me. What defines me is taking my health in my hands and taking control of it, because no one else is going to advocate for your health like you will, because I've got some important people I want to be around for a while. I've got my wife, my 3 kids, you have your wife, we all have loved ones and friends, and I love what I'm doing, and I know you love what you're doing. I want to keep doing this. And so that's where the real strength is. It's not suffering in silence, being a stoic man. Listen, this isn't the 1950s anymore. Like, we got to find a balance. Like, yes, I think we've gone a little bit too far, to, age myself a little bit. I'm in my late 40s. Some of these quote kids have gotten a little soft and, think they're special snowflakes. But the same token, we don't need to be that stoic guy that like our fathers or grandfathers were, who's talked about nothing. Like, there's a happy medium where, yes, we are men, we deal with pains, and we shouldn't be complaining at every moment. But when it comes to our health, we've got to speak up and we've got to advocate for each other.
Yeah, it's so true. And I think always balance is the key, right? As you said, a
Yes.
happy medium. We don't have to be too far this way, too far this way, but a happy medium is where you want to be. And it's kind of crazy to me because the only people that are really suffering is you, right? The patient who thinks you're going to bury your head in the sand or you don't want to talk about it. And then probably your partner, whatever that looks like, they're not going to be happy with the situation. Why wouldn't you want to take the necessary steps other than it's a hurt or prideful thing or bruises your ego or maybe the peer pressure? But at some point you have to realize what's important. And that's probably going to be your wife, your boyfriend, your girlfriend, your partner, whatever that looks like. And this can improve that. This can help you.
Absolutely. We just got to normalize these conversations, have them. Listen, you come to see me
Exactly.
in the privacy of my office. We're going to talk about this. No one's going to know what we talked about, but guess what? I've already had that conversation with 1,000 other guys before you, and we can help and make a huge difference.
Exactly. It's all about starting the conversation, which is fantastic. So
Yep.
what's the one thing, and I'm guessing I know what it is, but what's the one thing that most men lie about in the bedroom as we kind of finalize the bedroom portion of this?
Oh, I mean, this is an easy one in that, they obviously lie about their sex life, right? They especially when it comes to ED or libido, listen, they'll talk about problems with their golf swing before they admit to any problems with their performance in the bedroom, right?
Yep.
And, listen, I think especially in today's day and age with young kids getting exposed to things on the internet at very, very early ages, like, not everybody is like long john stud who's got a massive penis and lasts for 45 minutes. Like, that's just not the case, guys. Like,
Thank
it,
you.
most guys have ED. Most guys have sex for about 5 to 7 minutes, and most guys have a penis that's pretty damn average and looks like 95% of other guys. I mean, let's be honest, as a urologist, I've looked at more penises than a porn director has. And when I look at most guys' penises, they're all about the same. So we got to stop this sort of machismo or thinking that what we see on some internet site is what either women or your male partner wants, or that you're, quote, not as manly when you compare to that person. I mean, geez, are you going to start comparing your pickup basketball game to LeBron? I mean, it's like these are people who are picked and that's their profession, whatever you think of it morally or not. And so we just have to, guys have to stop thinking all of their self-worth is down there. If they have an issue, come in and see a trusted professional. Not all urologists are created alike and practice the same just BS medicine. And we can have a real conversation. And number one, see if your concern is a valid one that needs some help, or if you just simply need a little redirection and recalibration, just a little
Yeah.
confidence booster like, dude, trust me, you're fine. Um, and then if there is something we got to work on, you're now in front of a medical expert who's going to give you actual things that will help, not some snake oil you try on the internet that can lead to a trip to the ER because of some device you bought online because it promised a bigger penis.
Yeah, exactly. And I think I found a new title for your new book. I've seen more penises than a porn director. So there you go. We got it right here on the Doc Stars and the DocPod channel. That's hilarious. But
I
you're
love it.
100% right. Because again, it's going to help every guy that does this. They'll be happier. I mean, once I was able to get this under control, I'm happier. My wife is happier. And so in the end, on the other side of it is happiness. So you just have to take the steps. And so these are all great points. And as I was, again, doing some research about the bathroom portion and understanding, overreactive bladders, also bladder Botox, UTIs. Some of these I knew, a UTI, kidney stones, but some of the others I didn't. Are these some of the more popular things that you deal with? Maybe explain a little bit about that.
Yeah, there's a lot of ailments that affect, the bladders, the kidney, and the urinary tract, especially as we age. And if, your bladder had a voice as you got older, it's screaming and you're just too stubborn to listen to it. Men will wake up 3, 4, 5, 6, 7 times a night to pee for years and not say anything. They'll just, quote, deal with it. And little do they know that not only is it annoying, it's literally killing them. I mean, chronic sleep
Wow.
deprivation has a number of effects, including lowering your hormone levels. But, sleep is the one thing that if you go without for a long enough period of time will kill you the quickest. I mean, you can go without water longer than you can without sleep before dying. And so, the fact that men, again, suffer in silence, and also women do as well. A lot of bladder ailments like recurrent
Hmm.
UTIs, overactive bladder, incontinence affect women. And if, men are just stubborn and won't go, women feel like they got to care for everyone, but don't deserve it for themselves. So it's interesting that it's different underlying reasons for not getting it treated. But just as a woman can go to the dermatologist over her lunch break and get some Botox, she could, during that same lunch break, come to my office and get Botox and filler of her bladder and fix her incontinence for a long time. But
Hmm.
yet, it doesn't happen. And that's because of not enough awareness, because of the stigma around, oh, if I have a bladder problem, I'm, quote, getting old. Listen, yes, we're all aging. That's the one thing we can't stop is father time. But guess what? There's ways to age gracefully, and we have minimally invasive therapies and ways to fix all this that sometimes don't even involve a procedure. But you shouldn't sit there and just, be running off to the bathroom every time in misery. And that goes for men and women. So, this is another reason why I think a urologist is well positioned to help people in this period that you and I are in, JJ. You start in your mid 40s having urine symptoms, and I alluded to that earlier. That's why I started taking a medication like Cialis because it actually helps men who are having dribbling, starting to wake up at night to go to the bathroom. And that's been a game changer for me. So there are safe things that we can do if you speak up.
That's very interesting because you touched on something which I want to mention briefly. So, when you talk about getting up in the night and using the bathroom, maybe someone's listening to this or watching this podcast. I generally get up about once on average throughout each night. Sometimes I'll be able to go throughout the entire night, and I'll even make adjustments to kind of my pre-sleeping schedule where, before maybe I would have liquids up until 8, 9, 10 o'clock before I went to bed, if I went to bed at 10 o'clock or so. And then I started making that adjustment and finishing those liquids a little earlier because I know that if I drink more, I'll probably use the bathroom more. And some nights I go all the way through without having to use the bathroom at all, which is wonderful because you don't get your sleep interrupted. But what would be an average, and maybe it's based on age, but maybe talk about what that would look like for a normal, healthy person or a regular person, a man, in terms of how many times, are average throughout the night, or is there?
There really isn't per se. And it's certainly, when we're younger, we have those iron bladders where somehow you can go out with your college buddies on a Friday night and
Yes.
drink more beer than you want to admit the next day. And you're somehow sleep the whole night and you don't wet the bed. And then, yes, you start in your 40s as a man and you have to be really intentional with your decisions. That afternoon coffee is going to bite you in the butt 7 hours later when it's still in your system. And now you got to wake up to go to use the restroom at night. We start making more urine at night as we age due to some other hormonal changes that aren't worth getting into right now. So it's one of those things that when it bothers you enough, come in and we often can find something we can tweak. Now, if you are miserable that you're waking up once at night and you're 60, you're not giving me much of a room of margin of error to improve that, right? I got to either get you to zero or you're still unhappy. So we also have to recalibrate expectations. But like everything, I don't like the term normal because it makes it seem as if you have to be X, and if you're not X, there's something bad with you. And it also means
Good
that,
point.
so I always look at how does it affect you? How's this issue impacting you on a daily basis? And if it's bothersome, come on in. We'll have a conversation. I can't promise I'm going to fix everything, but I'll at least do everything in my power to see what tool do I have in my tool belt that might be of use.
Yeah, and that's a great point because, as you say, we're all different. Every human is different. So, what is normal? Because I'm different than you, and my body's going to be different than yours. So, that's a very good point, and maybe not overutilizing that term normal, which I think is really good. So, in terms of demystifying these types of kind of taboo topics, as we talked about earlier, obviously having these kind of conversations. A lot of guys don't want to talk about premature ejaculation, incontinence, etc. Obviously, having these conversations is a great start. Are there other little tricks or tips you can kind of give us? Because not only are they going to be happier, but their partners are going to be happier and they'll have a happier, healthier life. But what are your thoughts?
I think it all starts with why. We have to start with what is our motivation for overcoming that friction that's in place,
Mm,
right? Because everything we do, it's all about friction. If it's something where there's little friction, we're going to easily do it. And if there's a lot of friction, we're not going to do it. And one way that worked for me is, again, going back to, well, why should I do something? Well, I've got a wife, I have 3 children. I have a lot I want to accomplish in this life. I spent a lot of years as a kid unhappy. I spent a lot of years in the library dedicating myself to learning my craft. I feel like I've got a lot of life I haven't lived yet, and I want to live. And hopefully, if the good Lord so chooses, I'll be around for a while, and I can be in the driver's seat of my health. And so you've got to think about, what if you don't make a decision, if you don't overcome that friction and do something, what's the potential side effect? Because I think anyone who's cared for an aging, sickly parent knows how hard that is. Anyone who sees the pain on their children during that process knows how hard that is. And as a physician, JJ, I have a very privileged position of watching people through various stages of life. And I see some people who age gracefully, and I see others who don't. And when I see those who don't, it really scares me because there are some people who reach a point where I can't help them anymore. they've crossed that barrier of that point of no
Yep.
return where they have unrelenting back pain and there's not a back specialist in the world who can help them, that they have had a heart attack and a stroke and they have partial paralysis and they're never going to walk normally ever again. I'd rather go through temporary short-term pain that is on my terms and I can gamify and have fun with and gives me some sort of joy even during that pain, versus the alternative of a chronic unrelenting pain I have no choice over. And that's why most of the time for me, I'm in bed by 8:30. Now,
Yep.
I'm pretty damn boring. Like people joke with me like, "Oh, Joe, it's 7:30. We better end dinner. We got to get you home." And that's cool. Like, please make fun of me. Like, it's that important to me. 80-90% of the time, I'm putting whole nutritious foods in my body that include lean proteins and vegetables. So that means when everyone else is ordering noodles and pastas and orange chicken and fried stuff that looks good and having dessert and lots of glasses of wine, I say no thanks. Now I still enjoy those. It's just not every day. And so to me, that's how I got out of it. When I stopped looking at health as I'm just going to make myself miserable for this short period of time and join a gym, go on a diet, really commit to a healthy way of doing things. Because we all know it's not sustainable. And the day I switched and said, you know what, your health journey is nonstop. And every moment is part of that journey. And I want this to be a long journey. I want it to be a happy journey. And I switched my mindset and said, this is my life. This is my lifestyle. These are my behaviors on a daily basis as a healthy person moving forward. And stopped looking at it as, oh, I just ate too much over the holidays. I'm up 5 pounds. I got to go hit the gym. Like, you're going to have your ups and downs, but the journey never stops. And if you don't treat your health as such and you ignore it most of the time, it's just a matter of time before you fall off that cliff.
Yeah, it's so true. I have so many friends that I speak to this all the time about, and probably my wife is tired of me saying it, but I always say, for me, I try to live life at that 80-20 margin. If I can do 90-10, even better, but 80-20. 80% of the time, I'm eating really healthy, plant-based, fish, all the nuts and fruits and vegetables, and I'm exercising every day. But also the other 15 or 20%, I want to enjoy my life too. I want to have some ice cream. I want to have a glass of wine. But I do know that sometimes I kind of dial back. What I've also realized is that when I have that red wine later at night, I don't sleep as well than if I have it earlier in the evening. So all these little tips and tricks. But I think the thing that you spoke to, which is most important, is whatever you're doing, it has to be consistent, right? Otherwise, it's just temporary. And that means you're going to get caught on that rat race of just doing the same thing every 6 months and then giving up and then going back. In fact, some of my good friends tell me, they go, why don't you give me a program that you're doing? Because I want to do that. And I said, listen, they would say, what's the best program that I should do? And I said, the one you can be most consistent with and do it for the rest of your life. And they look at me a little bit stunned, but that's kind of speaks to what you're talking about, right?
What a great piece of advice. I mean, the best workout program, the best nutrition plan is the one you're going to stick with.
Yep.
And people don't realize that healthy people don't have more willpower. Healthy people have better systems. I want to say that again. Healthy people don't have better willpower. They just have better systems. I'm sure, JJ, like me, you have cravings. And you know why? Because you're a human being and that's normal. So, last week I hadn't had a glass of red wine in probably about a month. And it really sounded good to me and I really wanted it. So I opened a bottle of wine and I had one glass of wine. Now, similar to you, I realized like this may affect my sleep tonight. I should probably have a little bit earlier. Let me make sure I drink a lot of water. I have to be much more intentional than when I was in my 20s or even 30s, where it was like bottle open every night, have a couple of glasses. Like, it's healthy, right?
Exactly.
It's not for those who are wondering. You just have to be more intentional. But I agree with you. You have to live life. When I take a vacation to Italy, I'm going to enjoy pasta. I'm going to enjoy bread. I'm going to enjoy some wine, but I'm also going to probably walk 15 to 20,000 steps a day. I'm going to find ways to do some workouts in my room. I'm going to balance it. I might do some intermittent fasting. I'm going to do some
Exactly.
things because I understand that if I truly just go off the deep end for 2 weeks, how much work I'm gonna have to put in to get back to where I just was, especially at this stage in life. And so you have to balance, you've got to show yourself grace, and you can't think like, I put on 5 pounds this week and I might as well just give up. No, no, it means you're human. It's all good. A weekend is not going to define your health. One burger won't make you, and one burger won't break you, and one salad won't make you. Like, it's not
Yep.
about one meal or one weekend or even one week. It's a moment in time. Lean in, think about how the next time you're in that situation, you can do it a little bit better, and just get back onto that 80-20 principle that you have.
Yeah, yeah. I mean, again, I don't want to go down the kind of dietary nutrition rabbit hole, but you are so right because, my wife is Brazilian. I have family that live in Europe and I travel a lot outside the US. And I see another thing that really hurts us in the US is our portion sizes, right? And it speaks to what you're talking about. Yes, I have ice cream and it's not sugar free. It's regular Haagen-Dazs, but it only has about 4 or 5 ingredients. And I have that about maybe 5% of the time when I want ice cream. The other time I try to be healthy. But I don't need to have everything sugar free if 80 to 90% of the time I'm having smaller portions, I'm exercising, I'm eating a really good diet, etc. So these are all great points.
Yeah. I
Yeah.
love your tactics.
I mean, and again, there's plenty of data on this. It's just about setting your process, like you said. And once you set that process and you understand it, and then you start to get those really good habits going and you get that habit, then you're on your way. And I think that's such an important part of it. So, okay. So talking about the boardroom, when I came across this, I found this very interesting in a different way to look at it. But what does that mean to not yourself, but someone like myself as I'm reading that? What does that mean to kind of optimize performance in the boardroom?
I think we all have boardrooms, and sometimes that's literal if you're an executive, or sometimes that's the household if you're a stay-at-home mom managing
Mm.
the you're the CEO of your family. And this speaks to the fact that all of these things are related, that your performance in the bedroom can directly impact your bladder and prostate and kidney health, and that how that impacts how you are in your boardroom, whatever your personal boardroom looks like, whether it's a small office or you're walking into some large corporation. It speaks to the fact that we want to optimize how you perform in these areas, because these areas matter. I've yet to meet a guy who how he peed and how he performed in the bedroom and how he performed at work didn't matter to him. And same thing with women, especially if we take time and ask them and listen. Women care about their performance in the bedroom.
Hmm.
They don't like wetting themselves. They don't like being tired moms who feel like they're running around stressed out all day. And so I want to speak more to people, real people with real issues, because listen, no one has ever walked into a doctor's office and said, I want my rheumatoid arthritis treated. They walk in and say, my wrists hurt, my knees hurt, and my vision's off. What can you do to help me, doctor? Like, it's us on the healthcare side that like to take a bunch of symptoms, label them as some diagnosis with some stupid long ass code for insurance companies so we can submit it and get approval to prescribe a medication. Patients come in with problems and symptoms. They don't come in with diseases and labels. That's what we do to make sense of all of it. And so, the boardroom is to help people kind of wrap their head around, like, just because you're not sick doesn't mean that you don't deserve to be healthier, that you don't deserve to feel better, that you don't deserve to be more optimal. And nothing drove me crazier than walking into a doctor's office myself as a physician and being told, you're fine. Well, guess what, bro? I don't want to be fine. I want to feel great. I want to be optimal. And that's what I want for my patients. And I really, my journey through Pazona MD and what we have created at this point in time and what we're continuing to create, if I can be perfectly frank, is selfish, because I didn't know where to go for my own healthcare. I had to interview
Wow.
doctors and get their thoughts on things. I'm like, no offense, but I know more about wellness and longevity and nutrition than you do, but yet this is, quote, your area of expertise. Like, come on. Um, and so people are demanding that level of healthcare these days. People are savvy enough. I'm not the only person, although I am ridiculous about my health. I'm sure there's other people out there like me who want that expert opinion and want that guidance of going beyond just, quote, normal and fine. And so that's where the boardroom came from. And it also kind of rolls off your tongue with bedroom and bathroom. So I figured, hey, why not?
Yeah, the three B's. And again, I think, and we'll talk a little bit more about this in a minute, about kind of advocating for yourself, right? Because my question is, what don't people know about the corporate hospital boardroom and that sort of thing? But there's a lot of information out there we could also do. And talking about what you just said, sometimes I go into different clinics and I've done my research because I'm a little bit anal and I like to be thorough and I like to have a core competency of what I'm doing. And then when I go in there and I ask them questions, I kind of get a little bit of attitude sometimes, and I get it because I also want to make sure I have some knowledge about what's going on. Is that the right way to approach it, or should I not really mention that?
I'm a big believer in information is power, and I always try and bring humility into every patient encounter I have. And listen, I don't know everything. There may be things, JJ, if you came and saw me in my office, that you've honestly done more research into than I have, because it is impossible in 2025 to stay on top of and be a, quote, expert in everything, even as a physician, even as a specialist. I mean, if I just look in my field, prostate cancer, the way we are treating it now and all the advances in the past 16, 17 years since I finished my training, I, I can't keep up with it. If I spent all my time on that, I couldn't grow my business. I couldn't work on the wellness side of things. So we really do have to niche down and stay in our lane and know what we know. And so as a physician, I love it. Do a lot of my colleagues get annoyed? Absolutely. Do I also get a lot of patients who come in not with maybe with the wrong attitude, like, oh, well, I looked this up on Dr. Google, so it must be right, and I'm going to tell you, doctor, what the situation is. So, like everything, there's a way to present it.
That's right.
I think you can, I'm not an accounting expert, but if I come up with something and I go to my accountant and say, hey, listen, I came across this as a potential tax break. What are your thoughts? So I think it's all in the way you say it. I mean, yeah, as a subject matter expert, it doesn't feel great when someone who doesn't have your training to call, basically insinuate you're an idiot. But I don't come to the office with an ego or any bit of hubris. I'm always learning. I say the three words I don't know quite often, but they're usually followed up with, but let me look into it and get back to you.
Perfect.
Let's investigate that together. Or, what, that's a great point. Let's give that a try, because it's a patient physician relationship. It's not medicine
Yep.
in the 1950s where, again, the doctor walks in smoking a cigarette in a white lab coat and can just tell you what to do and you got to do it. I mean, it's a different time, but I can see the doctor side of it as well. Whereas, yeah, when I get someone who come in who's done like, this much research, and can I just ask you a couple questions? It's like, ooh, especially in the old model where I've got 20 other patients waiting for me, like,
Yeah.
dude, like, not really appropriate for what we're doing today. Let's focus on, let me get a good history from you. Let me do an appropriate exam. Let me give you my thoughts. Let's answer a couple questions. And if we got to go through this, we're going to have to schedule another visit, because it's just, you got to be respectful of people's time here.
Exactly, totally. And I think also it speaks to those of you that are listening to this podcast or watching us. Remember that delivery matters both ways. That hubris, sometimes from the doctors, can also be from us patients. We get a little cocky. I read something on AI. Next thing I know more than the doctor. And so these are great points. And actually, at the end of the show, we're going to talk about some of the myths, because I think part of what we want to do on the DocPod channel with shows like this is to kind of break through some of these myths. We always have to question Dr. Google, as you said, in YouTube and influencers. Let's use data, board certified data, evidence-based. Just seems like the way forward. So great points. Now I want to take just a minute to talk a little bit about the advocacy part. And again, you and I talked about this previously. We did a call and I shared with you that I had prostate cancer, and I had found out about 7 months ago that I had prostate cancer. And I thought it was interesting the way when I was telling you how I found out, because initially my PSA had been going up, but it was under 4. And I went to maybe 3 or 4 different urologists and doctors, and they're like, "You're fine, JJ. It's under 4. It's no problem. When it gets above 4, you let us know." But I was doing some reading online and tried to understand my own body a little better. And what I found out was that that might be the case. And you'll speak to this, I'm sure. But what I also found out was that my PSA was going from, like, say, 1 to 1.8 to 3.6, and it was doubling almost every year. And that was a problem. And so I went ahead and got it checked, and I went to a doctor. And unfortunately, they did do a biopsy, which was great. But after they did it, they said I would be okay, that it wouldn't kill me, and I should check back in a year. I didn't feel good with that. Long story short, I had a second opinion, and I then had an MRI done, and they found out that no, we need to look at this a little further. Now we know exactly where we're looking. We'll do a proper biopsy again in that area. And I did have it, Gleason 9s, as we had discussed, and I was in there 3.5 weeks later and had my prostate removed. And so for anybody listening or watching, this is all about, for me, about advocacy. There's no reason why you wouldn't do this. My wife is happy. My dad is happy. All my friends and my loved ones are happy. So we'll talk about that for a second. And what are your thoughts?
Well, JJ, first and foremost, thank you for your vulnerability. I think it's so key for men to speak up about their health issues and advocate for others, because your story could have turned out a lot worse.
Yep.
Thank God you spoke up.
Yep.
Thank God you had that funny feeling in your stomach and you went and sought a second opinion. Listen, whenever a patient comes and sees me and wants a second opinion, I'm happy. I love it. I think it's a fantastic idea.
Yep.
I don't know everything. And more importantly than what I know or not know is I need you as the patient in this relationship to be comfortable and confident in the decision that we're going to make together. And if you have that uneasy feeling, doctors make errors. Doctors don't know everything. Please go and talk to someone else. And very often it's like, well, hey, I met that other guy. He agrees with you. I feel better now. I'd like to, continue my care with you. Or sounds like he's an expert in prostate cancer. What are your thoughts? And I say, great. I agree. I sent a lot of patients to him. He's a fantastic surgeon. He should be the guy to take out your prostate if it's something you're comfortable with. And so it's amazing how we feel this loyalty to doctors as patients, as if it's this sacred bond that can never be broken and you're never allowed to go see somebody else because you'll, quote, hurt their feelings. Hate to tell you, most of the doctors who are not worth their weight in gold anyway, they don't even remember your name the second you walk out of the damn room. You were the 2:15 appointment. And so to think that you owe that person anything, especially if you don't get that right feeling or you've got something serious to go see someone else, you don't owe them anything. I mean, we joked about this yesterday, JJ. How often would you go to a restaurant and wait at a hostess stand for 10 minutes and nobody shows up? And would you ever go back to that restaurant? Or
Nope.
if you, even worse, you sat down, the meal was okay, but it cost you a lot of money, you'd never go back. You'd be on Yelp that night. How dare they? Like, this
Right.
steak was overcooked and, they call this fine dining. But yet we'll go to that doctor for decades because, quote, well, my family doctor says Dr. So-and-so is a good guy. This isn't about whether you're a good guy. Is he a competent surgeon and physician and specialist for the problem that you have? Do you feel confidence in him? Does he do everything to make you feel heard? Is he an expert in his field? And listen, I try to be a nice guy, and I think most patients like me. There's plenty of times I go, listen, I'm not the expert you need right now. You've got X. I'm going to send you to so-and-so. They're the guy who's best going to take care of you. And I've done that from the very start of my career. I've always felt that if I can't offer the patient the best in class procedure and they have options, I owe it to them to go elsewhere. That's what I would want on the other side, and I've
Yep.
always done that. But not every doctor does, you know. So if you look up a doctor on the internet, especially a surgeon, and they say we're experts in, whoop, you know, the virtual Rolodex opens up and it's 30
Exactly.
conditions. Like, run away. Like, you're lucky if you're good at like three things. And so I appreciate you speaking up, JJ. I think getting second opinions is important. And you also bring up another point. I'm sure you wouldn't look back and think any of your doctors were bad. I'm sure you wouldn't look back at those urologists and think they were maleficent in any way or that they didn't care. But again, medicine changes rapidly. Like the old fashioned notion of a quote normal PSA of anything under 4 fits all men is just false. If you have a family history of prostate cancer, if you're in your late
Hmm.
40s, early 50s, if your PSA is not under 2.5, and if it's doubling every year, that needs an immediate MRI with an MRI guided biopsy. And who knows what would have been found if that were done. And here you are, an educated guy who takes care of himself, who's an advocate, and yet still that was your experience. So not all doctors are created equal, and that's what I love about what you're doing here at DocPod, is that you're hopefully giving a voice to, you know,
Hmm.
doctors are just looking at things a little bit differently. And listen, it's a relationship. I get it. Not every patient who comes into our practice loves us. That's fine, but we have 1,000 5-star reviews, so some think we're all right. And there's other medical practices like ours that are out there.
Yeah, yeah, and I think these are amazing points, Joe. I mean, what you're talking about speaks to, again, advocating, and I don't know, maybe it needs to start earlier in school. Maybe we need to have these conversations and create these narratives where people understand how important it is to advocate for yourself. But I do find it interesting that people go out and when they buy a home, do you know what they do? They go and get comps. That means they get second, third, fourth opinions on the value of something. So if you're doing that for your home, and your body and your life is the most important thing, you might want to get a second or third opinion. It's okay. It doesn't mean that you think that doctor is bad or whatever, but I think more good evidence-based information, the better. So I think these are all great points. So first of all, we kept you really long today. Can't believe it's already been an hour and 5 minutes. You've been amazing, by the way. Thank you so much. Your mission and purpose in terms of where people can go to support kind of what you're doing. Obviously, we know about Balls Deep, but maybe tell us where everybody can find you, because I think what you're doing is fantastic and this kind of stuff needs to be shared.
Well, JJ, thank you for the kind words. You know, it's my pleasure to be on here. I love what you guys are doing here at DocPod, and that you are aggregating world-class information and medical experts, so people do have a trusted source to go to. So now if someone goes, hey, I saw this on DocPod, it won't be quite as triggering as I search this up on Google or ChatGPT, right? That's your
Exactly.
goal. But no, I mean, listen, if you're curious, confused, you're tired of being dismissed, like, come hang out with us on Balls Deep. We get real, we have fun, we give you information that is hopefully going to be valuable. We started the podcast because, again, we wanted something that was approachable, gave you a smile for that day and some actionable things that you can work on. And then if you know, you're in the Middle Tennessee area, or you want to look into being a patient of ours via telemedicine, you know, you can find us at PazonaMD.com. I'm sure you guys will have some links in the show notes here. And you know, we just want to be a resource. So whether or not we're ever form a doctor-patient relationship, come check out our podcast on YouTube, and we would love to hear from you there. Drop some comments. Would love to get future ideas for episodes. And you know, JJ, again, I love what you're doing. I want to thank you again for being so vulnerable and speaking up as a man. I mean, as a men's health expert, you don't understand how powerful your story is for other men, because most men would just look at you and go, what does JJ know? He's young, healthy, good looking guy. Like, he doesn't have any problems. Like, you know, we got to get curious and stop making assumptions about people and realize that prostate cancer doesn't care how young you are or how much you take care of yourself. And some of these other diseases are very similar. So we got to speak up. And I really appreciate you inviting me on today.
No, thank you. And again, there are many men who came before me, and I'm sure hopefully part of what we're doing today is that there'll be many other men who are going to speak up. So again, I'm just going to be one in a long line, but I think we always have to keep that going, right? So it's very interesting. As I was going through kind of the end of this and doing my research, and I was thinking to myself, so what would Dr. Joseph Pazona say if I said, what's one topic you think that no one is really talking about, but absolutely should be? Because I'm always trying to get ahead of things. And I understand ED and a lot of the stuff we talked about today. But what am I not seeing that probably you know about? What are your thoughts there?
This may seem obvious, but I still don't think it is being talked about enough, is we are just sitting in silence during this obesity epidemic that we have. 40% of US adults are obese, and it is the root cause of most things that are going to kill us. And yes, there's been get skinny tricks since the 1980s when I was a kid, back in the day where it was Richard Simmons aerobics.
Yep.
And, we thought that the cure was low fat, high sugar, and we got that totally wrong. And yes, there's still plenty of people talking about it today, but we're still just sitting there stuffing our faces with processed food. I mean, it's equivalent to letting your kids smoke cigarettes. I mean, you might as well light up a cigarette and hand it to your 9-year-old if you're sitting in the Chick-fil-A drive-through. And don't tell me you don't have enough time, because I run 2 companies. I'm married. I've got 3 kids, and I work out every day, and I eat clean most days of the week. Don't tell me that it costs too much money. I can make an entire meal for your family that costs a lot less than your Chick-fil-A drive-through bill, that is nutritious and your kids will eat. And you know what?
Thank
I've
you.
yet to meet a kid in this country who has food on the table on a regular basis who's starved to death. So yeah, it's a little painful at first, but let little Prince here go a day without some fast food. He'll be just fine. So hate to give a little tough love here to end it, but it's killing our country, and it is leading to literally every disease. It makes everything we do as doctors more difficult, from vasectomies to open heart surgeries to routine gallbladder removals. When you are overweight, everything is harder. COVID, if you look at that, 75% of deaths were people who were obese. So I'm not into fat shaming. I'm not saying that it's easy to lose weight, but it's important and it is simple. We just have to start having these conversations. So I
Yeah.
think that's the one thing we're not talking about on the patient side. I think on the healthcare delivery side, if I might add, JJ, because I think this is equally a big problem, we're going to run out of doctors in this country. And
Interesting.
it's not a matter of if, it's a matter of when. And there will be a day where no matter what insurance you have or where you live, you're going to struggle to find any doctor to get in and see, because bureaucracy each year increases, reimbursement continues to decline. We seem to be advocating for insurance companies and big pharma, and
Yep.
doctors are burning out. They're miserable. They're leaving healthcare early. And here's the scariest statistic I've heard in probably the past year. 40% of medical students who have been surveyed to ask, what are you going to do when you finish medical school? 40% have already said, I am not going to take care of patients. They have already
Wow.
peeked behind the curtain of what the day-to-day life of a doctor looks like and says, forget that, I'm out. And they're going to go be consultants and work at big pharma or start a company, you name it, but they're not going to care for patients. So again, I'm not a mathematician, but we have an aging population that's as sick as we've ever been, as obese as we've ever been, leading to every major disease. We have doctors burning out and nobody coming in behind us to fix. Like, I'd love to believe Bill Gates and Elon that AI and bots are going to be removing prostates in the future autonomously. I like to try and live in the gray area, JJ, but I'll be really surprised if that ever happens, that a robot will understand the nuances of having a robotic prostate cancer discussion with you and being able to cut you open and understand your anatomy compared to the next guy's anatomy. Like I have a hard time seeing that as a possibility. And even then, do we want robots to be our doctors, or do we want someone who can put a hand on our shoulder when we're crying, who can smile and make a joke at that right moment when you're feeling down and out and worried about your health, who can shake your hand and give you that confidence, like this is the guy or the woman who's going to take great care of me. So we've got to start addressing those. Those are the two biggest issues. And if we don't have enough doctors and we keep getting sicker and fatter, I don't know what's going to happen to our healthcare system that's already broken today.
Yeah, these are amazing points. And I think really it speaks to that personal touch because there are nuances there. All right. So to wrap this up, we have a little bit of a tradition on the show. It is called 3 Myths in 3 Minutes. So I'm going to give you the myth and you're going to help kind of dispel that, if you will. Erectile dysfunction is not normal. And unfortunately, there's not much you can do.
Total false. 50% of men by age 50 are going to get ED. So if that's not,
Wow,
again,
50%.
50% by age 50.
Wow.
So again, I don't like the word normal, but
Yep.
that's a coin flip that at age 50, you're going to have some level of ED. So the good news is we can fix it in the moment with a variety of things, including the little blue pill. But we can also, when you get in front of the right doctor, attack the root causes of that ED, because very often it's a blood flow issue related to your lifestyle or some hormones that need to be dialed in.
Yeah, and this is another question we kind of, in terms of myths that we discussed offline, was that when I mentioned to you, a lot of people think that doctors have access to and know the same information. Therefore, all doctors, i.e. all urologists in your case, offer the same care.
Not all urologists and not all doctors are created equal. Yes, most doctors in this country get excellent training. I think that's something we can say about the U.S. healthcare system is, doctors are coming out with all the tools that are needed to treat illness. But we don't learn wellness. We don't learn the business of healthcare. We don't learn how to have those difficult discussions with patients. And we don't learn to continue to be curious once we leave. I mean, isn't it interesting that to be a doctor, you probably had to be a pretty darn good student in high school, had to get pretty darn good grades in college, pass the MCAT, then get into medical school where, the books we had to memorize are best used as door holders. And, basically dedicate 10 years of my life towards medicine to learn my craft. And then the second we're out in the real world, that all stops. We have some, quote, mandatory continuing medical education. That's a joke. I mean, it doesn't ensure doctors are keeping up on anything. And if anything, it's just a box all the organizations like to make sure we check, going, see, we keep our doctors at the top of their game. Like, no, it doesn't. And so for those of us who didn't allowed us to get to the point of burnout, for those of us who are not complacent, yes, we have kept up and we've refined our game. I mean, you look at the elite athletes, it's not like they come out of high school or college and they stop training. I mean, that's when the real work starts. And in fact, you got to train even harder as you get older. So there's a lot of wonderful doctors that are in my network and I know are across the country who think differently. And again, show your doctor some grace. I don't condone all of their actions, but they are in a broken system and they just don't know what to do. I think we can all imagine being in a job where you are so burned out, but yet so dependent upon your salary. And it's so hard to think about opening your own practice like I did. I have a lot of empathy for my burnt out colleagues, but nonetheless, it doesn't mean you have to settle for burned out healthcare.
So true, so true. And again, I mean, obviously a small percentage that I see in the US is proactive and preventative. And part of that overall wellness that you're talking about, that percentage has to grow and hopefully will in the future. Maybe we do another segment on that because there's so much to talk about just in that space. Okay, last one. Yeah. Low testosterone just means you're getting older and there's nothing you can do about it.
low testosterone doesn't mean you're just getting older or lazy or broken. It means that your body's giving you a signal and you need to speak up. This is one of those areas that, again, I could dive into for 45 minutes, but where we call things, quote, normal, JJ, and we forget about what's optimal. And we've got the two camps of testosterone, of the bro science who are gym tweakers pushing illegal steroids, and then the traditional doctors who just basically ignore it because, frankly, our education during training for testosterone is horrific. But again, I've done my deep dive into this on my own 10 years into my career. And so there are hormone experts like Pazona MD who are that moral middle ground where we're not throwing every guy with a heart rate onto testosterone, but we're also not pushing you out the door just saying, lose some weight, you'll be fine. Just stop complaining.
Yeah, I know this is so true. And honestly, Joe, when I look through everything that you're doing, for me, it's almost like, redefining the modern man in healthcare, because I feel like so much of this is outdated, which we've, already mentioned. And what I've learned is that I listened to several of the Balls Deep podcasts, and at its core, the whole Balls Deep podcast for me and what you're doing is really, trying to do isn't just about urology. It goes a lot deeper than that. And so that's so important. It's about, tearing down this curtain of a broken system, as you mentioned, and giving men the tools to take back their health, their confidence, and their voices. And hopefully shows like this can help really convince men watching, because real strength, as you mentioned earlier in the show, real strength asks questions. It's not quiet. It seeks answers. And in my case, I felt like I was demanding answers, and it refuses to settle for less. So what you're doing is fantastic. Keep up the great work. And thank you so much, Dr. Pazona.
JJ, thank you so much. I really appreciate the kind words. And again, thank you for sharing your story. And I'd love to be back anytime you guys want to talk to another penis doctor.
I love it. And thank you for joining us today on DocStars. And as always, subscribe, like, and continue following the DocPod channel, because as we say, health, it's everything. Take care, everyone.
Celebrating the world's best. This is DocPod's DocStars.